So what we know is that people are more likely to access health services than they are to around domestic abuse than they are to sort of go firstly to places like police, social care, or even directly to domestic violence workers. And we know that actually somebody could attend health up to 30 times before they sort of then get in contact with other agencies that might sort of provide support. So I think that paints a picture that there is a lot of people being seen or going through health services, A&E included amongst those, where that support, that DV is not being picked up on. The project's been going now really only since August, so that's not a very long time when you sort of think of, you know, referrals and uptake and things like that. And given sort of the A&E crisis that is sort of being reported and the strain on services, the fact that in only 5 months we've already had about 23 referrals, 4 of which have come just in the last week, I think that paints a real picture of the severity of the situation. And I think the commonality of it and how frequent, we know the statistics around DV, 1 in 4 women will experience it in their lifetime, 1 in 6 men, 2 women a week dying. And you think, actually we're seeing so many referrals come through A&E, but probably, actually, unexpectedly, we're only touching the surface of what is really there. And I think, whilst we're still collating all the data and the research around it, what we've found anecdotally is that a lot of that information and a lot of those referrals are quite high risk and being referred to what's called the MARAC, so the Multi-Agency Risk Assessment Conference, which is the forum in which high-risk cases of domestic violence are discussed. And I think what we're also noting, for these cases is it's more than one issue. Domestic abuse isn't just occurring in isolation. There's mental health, there's substance misuse. So I think, in terms of what we're seeing and how sort of frequent that is, I think perhaps it's just the beginning of what might still be there and of the actual issue. So I think that's it's a difficult thing. I think when we think of the numbers, that's always hard to hear, and we know that it's, staff get affected and are being affected by this as well, so it's patient and staff. But I think what is positive about that is that those people aren't now just walking through the system, but they're being picked up. And actually 6 months ago, or 8 months ago, what was happening, where were those 23 people referred to? Were they picked up? What was being done? Were they completely being missed? So I think, balancing out the severity of the problem with the fact that we're offering not necessarily a solution, but an opportunity to seek help, I think is really important.